Now let's talk about the booking of these vaccination appointments too. The city says 133,000 appointments will be available to book at 3 mass vaccination sites starting tomorrow. Joining me now with the very latest for his weekly check-in is Toronto Mayor John Tory. Good morning to you.
Hi, Al.
I don't know if many people ask you this, and I am going to ask you about the numbers and the rollout, but how are you doing personally? It has been a year of leading the city of Toronto through what no one could have anticipated. How are you?
Well, I'm fine. I mean, it takes its toll on everybody. And so you just have to I have a job to do here. I've had 2 jobs to do. One is to continue to run the city in the normal way where everything has to keep going. And the other is to manage the pandemic. And so, but it's we're all human beings. And so we've all been had challenges put in front of us, and we've had, our lives disrupted, mine too. But having said that, you can't complain about this. You just have to move on and do your job. But it's been difficult for everybody.
As we look back on the last 12 months, it's interesting to see we went from a declaration of a global pandemic to now administering vaccines. It's very interesting to see where we were and where we've come. Let's talk about the vaccine rollout. We know 9 mass immunization clinics will eventually be opening up in the city. How is progress going? Because I know we are starting to get more of these doses.
It's going well, but of course the supply issue that you just mentioned has been the big one. I mean, we have 9 mass immunization clinics we're going to open, and I think fully 7 or 8 of them would have been available to open on Monday of last week, of this week, or earlier on. You could look in the window today and see the furniture there, but we didn't have the supply, and now that's getting rectified. So we're opening 3 of them on Monday. We're opening the booking system, as you mentioned, tomorrow. We have 27 clinics already going today. We have vaccinated 217,000 people. So we had a plan. And the plan was just slowed down by the fact that there wasn't adequate supply. Now we're going to have lots of supply, so they tell us. And it was slowed down by the fact we didn't have a booking system available, which now will be the case starting tomorrow and ramping up to a complete booking system starting on Monday next week.
Mayor Tory, I asked this of Councillor Joe Cressy yesterday when he joined us, but once the provincial system is up and running, do you anticipate that they're going to somehow merge, or there's going to be sort of a learning period where there might be bumps in the road because we have our individual one and there's the provincial system?
Yes, I think our intention all the way along, given the complexity, if you think about it for a sec, we have to vaccinate 3 million people in Toronto, and this is a task that no one else faces anywhere in the country. And it is complex, too, because there are all kinds of groups. You know, the province has set out this priority list so that you've got all different kinds of people and workers that are going to be done in priority order. And so we came to the conclusion quite early on that it was better to have one kind of centralized system where all that information could be contained, as opposed to having 10 or 15 or 12, systems. And so we will be relying on the provincial system. It may have hiccups. I mean, I ran a big company at one point in time, and, there were always some systems that were, going wrong on the first day they were turned on. So that may be to be expected, but I hope not. I hope from the preview of the system, it seems to work well and be quite easy to use for people. They need to have their health card and their health numbers. They need to have their date of birth, which most people have in their heads, and they need to have their phone number and an email address if they have one. And, and there will be a call center accompanying it starting next week, not just yet. So, I hope all that makes it easy for people, because that's what we want. We want people to find it easy. We want them to be enthusiastic and positive about getting vaccinated, and then we want to actually get it done. And I think we have the latter part completely looked after. That's what I believe.
I'm glad you said the phone system, and that's a lot of feedback that many people have been reporting, especially for those 80 plus who maybe can't navigate the online system, don't have someone to assist them. So that's definitely important. I want to ask you about Toronto right now, sitting in this gray zone. Do you anticipate we will be staying here for some time?
Well, when you say some time, I mean, I don't think it's going to change tomorrow, but my objective is to change it to red as quickly as possible, so that with red you get some additional businesses opening, subject to conditions like the restaurants and the bars and the some of the personal service businesses. And so I would like to move us to that as soon as we can. But that will depend on what I've said consistently are sort of 4 things: the health situation being the most important, followed by the psychology of the public, because if they're not following the health regulations or whatever, then you're not really achieving any purpose. Followed by the regional situation, because obviously, again, Toronto's not an island. We're part of a region of many millions of people. And then last but certainly not least by any means is the business situation. I think you have to take that into account, the toll that's being taken. So we're having these discussions virtually every day. I'm talking to the province about it, and as well as to our own medical people here. And I hope we can move to a change as soon as possible. That's all I can say. And I hope that's much sooner than later.
Okay, I know a lot of people are anticipating that. Mayor John Tory, thank you. You know what? Please do stick around because this is your first time to talk to Dina and Sid.
Sid. Oh, Sid. Yes, of course.